Hey guys, welcome to our video for the post-operative guide to dental implants. So in the first 24 hours, here's what you should expect. From a pain perspective, the amount of pain you feel after the implant placement has a lot to do with the number of implants and the number of other procedures like extractions and bone grafting that's all been done at the same time. The more procedures that were done at once, the more painful the healing process is going to be. If this pain increases significantly a few days, 3 to 7, after the implants were placed, please give the office a call. We want to make sure that you don't have a post-operative infection. Regarding bleeding, you will bleed for the first 24 hours after surgery. This is completely normal. Keep in mind that when blood mixes with saliva, it may appear as if you are bleeding more than you actually are. Don't sweat it if you're still bleeding when you go to bed. Just put a towel over your pillow and try to get a little shut-eye. Regarding swelling, you are probably going to experience some degree of swelling after surgery. The amount of swelling you have will depend on the number of implants placed and the size of grafts or number of extractions performed simultaneously. The swelling is usually greatest in the first 4 days and should start to decrease by days 7 to 10. If this swelling significantly increases a few days, between 3 and 7, after the implant or implants were placed, please call the office for instructions because we want to make sure that you do not have a post-operative infection. Regarding sutures, if sutures were placed directly after surgery, you might feel them with your tongue. Do your best to leave these little guys alone because messing with them is ultimately going to negatively affect the healing process. The time that it takes your sutures to dissolve has everything to do with the type of sutures used and how your body reacts to them. The sutures may start to come out anywhere between 2 days and 2 weeks after surgery. If non-dissolving or non-resorbable sutures were placed, our office will need to remove them anywhere between 2 and 6 weeks after the day of surgery. Let's talk about a couple strict no-can-dos. Number 1, do not rinse with anything for the first day after surgery. Number 2, do not spit, suck through a straw, or touch the surgical site. Don't even pull on your cheeks or lips to look at them for the first 7 days after surgery. Number 3, do not rub or apply excess pressure to your face to massage the area if any bone grafting was performed. The bone needs to heal without any outside pressure. Number 4, do not smoke or drink alcohol for the first 3 days after surgery. We recommend that you quit smoking completely. Number 5, do not exercise, mow the lawn, vacuum the house, or play sports for the first 5 days after surgery. All of these activities tend to increase the risk for bleeding. At a bare minimum, for the first 24 hours, you should be nothing but a couch potato. Do not eat or drink hot foods or beverages. Warm is okay for the first 7 days after surgery. Remember, the first 24 hours should be nothing but cold. Number 7, do not consume spicy foods, chips, popcorn, carbonated drinks, or acidic juices like orange or grapefruit juice for the first 14 days after surgery. So what are some things that you can do to improve your healing? The first is pressure. If gauze was placed by one of our assistants in your mouth, bite down gently but firmly, making sure that these stay in place. The easiest way to do this is by not talking. Do not change them for the first hour unless bleeding is not controlled. The packs may be gently removed after 1 hour. If active bleeding persists, place enough new gauze to maintain pressure over the surgical site for another 30 minutes. The gauze may be changed as necessary, which is typically in intervals of 30 to 45 minutes. It's best to moisten the gauze first, not too wet, but certainly not dry, before putting them in your mouth. Regarding cold packs. So, as you leave the office and when you arrive home, use a cold pack on your face next to the operated area to keep down the swelling. Keep the cold pack on for 20 minutes and then off for 20 minutes. You can repeat this cycle for the first 36 hours after surgery. Regarding your medications, take all the medications given or prescribed as directed. You may have started some of them just before the surgery. Take these medications with food unless stated otherwise, and the exception to this rule are narcotic-type pain medications. If you choose not to take those, that is completely fine with us. Oral hygiene. Do not rinse your mouth for the first 24 hours. Starting 24 hours after surgery, you may begin rinsing. You may also begin to brush and floss the remaining teeth, the other teeth in your mouth. But be extremely careful around the area where surgery was performed. If you're uncomfortable brushing the surgical site, then please don't do it. The area will be just fine on its own for 2 weeks. Do not, under any circumstances, use a water pick or water flossing device because these are traumatic to the healing process. When rinsing with a prescription mouthwash, well, you can use the prescription mouthwash, Listerine, or warm salt water. This is going to help keep the treated area clean. If you want to make a warm salt water rinse, take 1 teaspoon of salt and put it in a half glass of warm water, remember not hot, and I caution you not to rinse vigorously. Instead, put this in your mouth and then gently rock your head from side to side, bathing the surgical site in the solution. Regarding your diet, most of our patients find it difficult to sit down and eat a normal meal after dental surgery, and it's not difficult to see why. Chewing or chomping down on the surgical site, which is the worst idea, will probably result in pain. It can also reopen the surgical site or move the implant, which would possibly result in a post-operative infection or some potential negative healing complications. So we suggest that you eat soft foods, take smaller bites, and chew only in areas where the surgery was not performed. Avoid highly seasoned foods or sharp foods, like nuts, popcorn, or potato chips. It's important to maintain a healthy, nutritious diet while you're healing. These patients tend to heal faster and have less discomfort after surgery. Make sure that you're taking a vitamin supplement. It's great to have a balanced, healthy diet while you're healing after dental surgery, but all too often this is not enough. A lot of Americans walk around with vitamin deficiencies that they are completely unaware of, and this could potentially negatively affect how you heal after surgery. It's our recommendation that you take a high-quality multivitamin supplement while you're healing. In particular, we want to make sure that you are not deficient in vitamin D, as there has been evidence to suggest that higher rates of implant failures occur in patients with vitamin D deficiencies. Therefore, we recommend making sure that your multivitamin has vitamin D in it. If it does not, please supplement it. Okay, from days 2 to 14, what should you expect? Regarding pain, sometimes the second day is as bad, if not worse, than the first, but hang in there. I know you're going to get through this. Again, the amount of pain is directly associated with the difficulty of the surgery, number of additional procedures performed, all at the same time. Pain is usually worse for the first 3 days and should be gone by 10 to 14 days. If this pain or swelling increases significantly a few days, generally between 3 and 7, after the surgery, please call the office so that we can make sure that you don't have a post-operative infection. Regarding bleeding, you may still have a little bit of bleeding in the surgical site. This should mainly be in the form of oozing, and the appearance should be pinker than normal because it's mixed with your saliva. If you do still have heavy bleeding by the end of day 2, give our office a call and we'll take care of it. Regarding swelling, you may experience additional swelling from what you saw in the first 24 hours. This swelling may continue to get worse by the second day, but it should level off by day 3 and slowly begin to decrease by days 4 and 5. Again, the amount of swelling will be directly associated with the difficulty of the surgery and number of additional procedures performed at the same time. If this swelling increases significantly a few days, between 3 and 7 after surgery, please call our office so that we can get a hold of you to make sure that you don't have a post-operative infection. Regarding bruising, the development of a black, blue-green, or even yellow discoloration is the result of blood spreading under the tissues on the outside of your face. It's quite normal for bruising to occur after the first 2 to 3 days of surgery. The size and length that you'll have the bruise is directly related to the size and complexity of the procedure. Most bruises go away by 7 days, however, sometimes they persist for up to 14 days and maybe longer. A lot of this has to do with how easily the patient bleeds as well. Okay, so what are some things you can do to help your healing process? Warm packs. So after the first 24 to 36 hours, cold packs can now be switched to warm packs, although it is not necessarily required. Gentle pressure is all you're going to need. Just make sure that it's not too hot. Regarding your diet after the first 24 hours is going to be a little different from the first. The only difference really is the temperature. So for the first 24 hours, everything needs to be cold. After that, it can be warm but not hot. As a general rule of thumb, if you can't easily pinch through it, you probably shouldn't be eating it. We suggest that you continue to eat soft foods, taking smaller bites and chewing only in areas where surgery was not performed. Make sure that you continue taking your multivitamin and making sure that multivitamin has vitamin D in it as well. So from days 15 and on, what should you expect? Well, from a pain and swelling perspective, you should no longer be experiencing any major pain by the 3rd week of healing. If you feel an increase in pain or swelling, please give our office a call. We want to make sure that you don't have a post-op infection. Regarding sutures, if resorbable or dissolvable sutures were used, they're probably going to be gone by now. But if non-dissolving sutures were used, they will likely be removed at your 2 to 3 week post-operative appointment. Sometimes we leave them in longer for specific types of procedures, and we'll let you know if that's you. If you feel a suture might be present after the sutures were supposed to be removed, please call the office and we will make sure that we have not left one in place. Things to avoid. Continue to avoid using the water pick close to the surgical site for the first month. Well, actually in this situation for the first 3 to 4 months after surgery. Continue to avoid rubbing or applying excess pressure to your face to massage the area, especially if bone grafting was performed. Remember, bone grafting heals best when it's not moving around. What are some things that you can do? So, by the 2nd week, you should be feeling pretty close to your old self and hopefully better. Discontinue using that mouthwash. It's no longer required. Continue to take caution brushing and flossing around the surgical site, but don't be afraid to keep the teeth around it clean. As far as your diet is concerned, it's always a good idea to continue to take smaller bites and choose softer foods only on the opposite side of where your surgery was performed. If surgery was performed on both sides, just make sure to follow that strict soft food diet that we reviewed in days 2 through 14. Continue this diet until your 3 to 4 month healing evaluation appointment at our office. Maintain vitamin supplementation. So take that multivitamin and make sure that it has vitamin D in it. If it doesn't, supplement it. So let's talk a little bit about implant integration. So the time it takes for an implant to fuse with the bone, which is called osseointegration, varies based on your overall health, the amount of grafting performed, and the type of natural bone present in your jaw. Generally, implants will take anywhere between 3 and 6 months to completely fuse with the jawbone for the process of osseointegration. Let's talk about uncovering your implant. So sometimes implants are covered with your gums and left to heal underneath your gums. This is by design. If your implants were covered, they will need to be uncovered before the tooth can be placed on top of the implant. Our office will have set up a date to uncover the implant based on the time we think your implant will need to fuse with your jawbone. Uncovering the implant involves a small 2nd stage surgery where an opening is made through the gums just above the implant. A healing abutment or healing cap will then be screwed into the inside of the implant, and it will be positioned so that it sticks up slightly above your gums, and you'll notice it with your tongue, or you'll probably be able to see it. The purpose of this healing abutment is to heal your gums in a circle so that there's an opening for the crown or impression material to be placed inside the implant itself. So for your final crown, so after the healing abutment has been placed, you will need a minimum of 2 weeks for those soft tissues to heal correctly around the healing abutment. The gums need to be stable before your final crown can be placed, and that's why we wait 2 weeks. So after all of this, what's next? So let's talk about how to maintain your results. While implants are currently the closest thing to replacing natural teeth, they are not the same. Implants do not form that same tight connection with your gums like your teeth do. And this puts them at extra risk for trauma and gum disease if they are not properly maintained. The following is a list of things that you can do to reduce the risk of disease around your implants after your crown has been placed. Number 1, brush your teeth and your implants twice a day for 2 minutes. Make sure that you are not just brushing the crown on top, but also the gums around the implant. Remember, bacteria that infects your implant will sneak into that gap between your implant and your gums. And if they go too deep, you will no longer be able to reach them to keep them clean. Number 2, floss your teeth and your implants once a day. Flossing an implant is completely different than flossing a tooth. Implants are circular, which allows you to floss them as if you were polishing a shoe or drying off with a towel. We have a specific video on this that you can see by Googling it. It should be in our list of videos associated with these. Number 3, see your dentist every 3 months if you have a history of periodontal disease, or 6 months if you have no history of periodontal disease. If you aren't sure if you have a history of periodontal disease or not, the following is a list of ways you may be able to tell. 1, if you've ever had a deep cleaning, or what we in the business call scaling and root planing. 2, if you've ever had a history of gum surgery in the past. 3, your past cleaning required you to be numbed to get clean. 4, your dentist had you scheduled to clean your teeth every 3 months. 5, you've lost teeth because they became loose. Or 6, your parents lost their teeth to gum disease, or your parents had a history of gum disease. Remember, implant disease is sneaky. Just because it doesn't hurt doesn't mean there's nothing wrong. Remember, there aren't nerves in implants, which means you won't be able to feel pain or discomfort in the initial stages of dental implant disease. Instead, the infection will be smoldering under your gums until it becomes a bigger problem. Unfortunately, by the time you do notice this pain, it's going to be too late, and unfortunately, there's possible irreversible damage that has already occurred. So, what's the solution? See your dentist or your periodontist on a regular basis. We want to catch something early to make sure there's no irreversible damage done. Let's talk about ways that you can eliminate some of your risk factors. So you've just made a pretty large financial investment into your dental implants. Therefore, you probably want to protect your investment by reducing or eliminating anything that might potentially jeopardize your implants. The following is a list of risk factors that have been shown to be associated with early implant loss or dental implant diseases. Number 1, a history of periodontal disease, which we just discussed. Number 2, smoking. This includes cigarettes, pipes, marijuana, and vaporizers. Number 3, poorly controlled diabetes, both type 1 and type 2. Number 4, cardiovascular diseases, including high blood pressure, strokes, aneurysms, atherosclerosis, heart valve disease, and acute coronary syndromes. Number 5, selective serotonin reuptake inhibitors, which are also known as SSRIs. Okay, and finally, I almost forgot, vitamin D deficiency, which is why we recommend multivitamins with vitamin D in them. All right, so that sums up this video for the post-operative instructions on dental implants. Hopefully this video was informative and gave you everything you need for a smooth and effective healing process. And we'll see you at your post-op.